Would you think that money is an issue too? Because it seems like we've talked about how there's easier ways, or like preventative ways are more helpful. It seems like.
Right.
But why aren't we doing it? Like,
Yeah.
Would the
Money.
doctors lose out on money if they use preventative methods other
Right.
than?
It's definitely way more expensive, I think, to do preventative care. I was lucky because I have Connecticut insurance, and this is where, insurance, it's almost an example of how insurance can be so helpful. They covered 80% of anything that I did with this doctor. I think partially because he was a legitimate physician and not just a random person too. But I think part of it is definitely insurance. If you have a really good health insurance plan like I do, then they're able to cover alternative methods, which really are just getting nutrition counseling or finding what happened to me or whatever. So I think it is because not everybody has Connecticut and not everybody has health insurance. That doctor that I saw, his first visit, if you don't have health insurance, was $225. That's a lot of money.
Yeah.
Like, it really is. It's a lot of money. But he could help so many people if it was affordable and cheap. But he can't because of his own costs. So I think price is a huge, huge barrier to getting preventative care because for some reason it's cheaper to get fixed after something is wrong than to get the preventive care to prevent the diseases and things that you were talking
How do
about.
other countries, like you said, Sweden, that has preventative, how do they go about having preventative?
Well, it ends up being an incentive for the government. So in industries where it's government-based and a public industry, it is beneficial to the government to focus on preventative care because it saves them money. So when all of a sudden your system is paid for by the government, or even if it's a public-private partnership, there's still some sort of public incentive, you end up benefiting from keeping people from being sick because being sick costs a lot of money. It just happens to be that our insurance plans will only cover that.
If you are here.
Right. So it ends up kind of switching just naturally because all of a sudden the government says we can't pay for all these sick people. We need to start preventing them from getting there. So it starts to become part of the system, and it's beneficial not only to the system but also to people.
So do you think if eventually we have so many sick people, maybe they will go to preventative?
Well, I think that we're kind of getting to the crisis point now. I mean, even just in the few years I've been doing this, like I've seen it get from bad to like really really bad. And because when I first started, it was mostly like low income folks who were getting really poor care and were having money issues, and now it's filtering up into other classes. And so in the United States at least, usually things start changing once it hits the middle class when you look at like movements. And it's definitely getting there now. So I think that's why there's Obama has a plan out right now that is sort of like covers everyone.
So other than him, has there been anyone else, any other steps in government towards?
Well, different states have done things, like California has a health plan, I think. Massachusetts has made steps for that. I want to say either Maine or New Hampshire, I'm not sure, but check with some of those states if you're curious to see what other people have done in the United States, have made some amends. And then Connecticut is working out now, obviously. We tried to pass in Connecticut a pooling bill. It was like it was like called a pooling partnership bill or something like that, where municipalities, nonprofits, and small businesses could buy into the state plan. And the idea was that would be one step in the direction of getting more people into one pool to eventually lead to everybody. But the idea was that the more people that were in that pool, the cheaper it would be. So kind of like what I said before about like if you go to Costco and you buy in bulk, it's cheaper. Same idea. So there are steps everywhere in the United States to do this, and I'm hoping that with Obama he'll start to push through some pretty good changes.
Hopefully.